this computer. All right, so we are recording, guys. Thank you so much for joining us on tonight's webinar. And I just want to give you guys a quick introduction. If you're just joining us, I am driving. I'm not going to be looking at you guys. Had a little mix up with two kids doing different sports all the way across town, as some of you have already heard. So I find myself driving when our webinar is starting. But nonetheless, I want to introduce you guys to Nate Craft of General Sleep and ZMachine Synergy. I met Nate at the North American Dental Sleep Medicine Symposium down in Clearwater, Florida. And, you know, I think Nate came over to the Dental Sleep Profits booth and introduced himself, and I started asking about their product. And when he told me about it, I was like, huh, that's interesting. I think that could actually be tied to profits and helping a sleep dentist actually grow their sleep practice faster. So I don't do this a lot. In fact, I don't think I've ever done it where I've featured someone's product on a Dental Sleep Profits webinar, but I wanted to do this because I actually believe that it can help you guys increase the profitability of your sleep practice and accelerate the growth of your sleep practice. With that being said, I have no affiliation with General Sleep or ZMachine Synergy. This is purely value-based. I wanted to give Nate a chance to just share what their product does and how it can help you grow your sleep practice. So with that being said, Nate, you want to take it away?
Thank you very much, Todd. I appreciate everyone joining us this evening and taking time out of your busy schedule. And so hopefully you'll find this evening educational. And for those of you that are looking to get into dental sleep medicine or add this aspect of dental sleep medicine, to your practice, hopefully I'll be able to answer questions and fill in some blanks of some things that maybe you were wondering. So I've just got a few slides that I wanted to go through in that, and then I think Todd's going to open it up to some questions at the end. But I wanted to talk this evening, and I'll try and tie all of this in as far as not just home sleep testing, but and how it can help, but maybe specifically, if you're going to get into home sleep testing, how a ZMachine can actually benefit you, maybe more so than some other devices. And so let me start with a little background. So our company has been around for about 25 years. And for most of that time, we've been making very cool devices and for the most part, white labeling them or licensing them to other manufacturers. But about 10 years ago, we came up with a very creative single channel 3-lead EEG. And it really made it much easier for patients to monitor brain waves. And over the last 10 years, we've continued to develop it. And about 5 years ago, we took that and turned it into a full-blown home sleep test. And so based on the recommendations of a lot of sleep physicians that we work with. And so for the last 5 years, it's been going very, very well. And we work with a lot of dentists. And I think as I go through this, you'll come to understand why it's a very popular device, especially in the dental side of things. So let's start with a little education and a reminder for some of you out there. If you're not doing this, or even if you are, you probably realize that before HSTs were popular, there is something called a PSG, or a polysomnogram. And this is a full-blown in-lab sleep test. And again, they serve their purposes. There's, as you can see on the screen there's plenty of pros and plenty of cons as well. If you go through and take a look at it, it's still considered the gold standard. I mean, look at, if you can see how many wires that gentleman is linked up to. They are collecting a lot of data. Okay.
Hey,
and so
Nate,
yeah,
we're not seeing the slide that you're on. You're still on your first slide on our screen.
really?
Yeah.
Oh my goodness. Okay. Well, let me stop share and see if I can do this again.
At least that's what that's what I was seeing. Hopefully, I don't know if anybody's seeing the same thing. There, now that's better. Now we got the guy hooked up to all the leads.
Okay. Maybe I didn't have it fully expanded. So, okay. Well, let me know if it continues not to switch. I may have to stop and start here.
Do you have dual screens?
I do.
You might have been sharing your other screen.
I see. Okay, got it. So on the pro side, though, again, you do have a registered polysomnograph tech who's attending and making sure that everything's going well throughout the evening. And again, you're looking for a variety of different things. So again, it's not just used for obstructive sleep apnea. But now on the cons, many of you probably have already heard of some of this, but number one, there's the what they call the first night effect. Not only are you hooked up to all these things, but you're not sleeping in your own bed. It's a different environment. You know you have someone watching you, so it's not a natural night of sleep like what you're used to getting. Of course, it's going to be a lot more expensive, both from, even if insurance covers it, they just charge a lot more for this. And then, of course, they're notorious for being backlogged. So, even if you were to send your patients, it may take them weeks or months to get in, and then when they do, they're not so happily surprised with a very high bill, and so it just doesn't leave for a lot of incentive for the patients to go in the first place, and that's why you see a lot of patient apprehension to go to these and do a full-blown HST. But I do want to make sure I tell everybody that, again, doing a PSG versus an HST, it's like the difference of looking at X-rays and MRIs. They don't serve the same function. They're similar. They can do some of the same things, but they're ultimately not necessarily doing the same function. Let me see if now it's not letting me switch screens. It's locked it, so I may have to stop and start this. I don't know why it's doing that, but it won't let me switch screens when I do this. So should I maybe get out of a full blown? Oh, you're muted there, Todd.
Sorry, what did you mean full blown?
Well, I have a full screen on here, but it's not allowing me to skip forward for some reason.
Okay.
I don't know why it's doing that.
Okay. Sorry about the technical difficulty, guys. So when you hit share screen, does it give you options?
It does. Let me see if it'll do it. Here we go. Okay. Are you seeing an older gentleman now?
Yep.
And if I go backwards, you see
you're
seeing a different. Yep. Okay. Perfect. Okay. All right. Maybe I just picked the wrong screen. I'm sorry, everyone. So let's take a look at the difference between a PSG and an HST. If you're looking at an HST, all right, again, you're mostly looking for obstructive sleep apnea, or at least to rule that out. That's its main function. Unlike a PSG, where you can monitor so many other things and look for so many other different diseases, with an HST, you're mostly looking for obstructive sleep apnea. Obviously, you get to sleep in your own familiar environment, which is always better for everyone. It's much more cost efficient. And so it's all of those negatives that we saw on the previous screen, they all turn into positives. Okay. From a con standpoint, it's really, there's really not many of them. And the fact that, yeah, okay, sure, you have the risk of the test not going successfully and having to repeat it because you don't have someone attending it. But that's really not that big a deal. You can do multi-night studies. That way, if a patient messes up one night, you have another night to go from. Second of all, obviously, yes, it's unattended, but I wouldn't necessarily put that in a con category. I think of that as a pro in my own case, because I don't have someone watching me, which sounds sometimes a little creepy in that. Again, and then lastly, obviously, if you do have a negative test, in other words, they have all the signs and symptoms that something's going on, but yet their score comes back less than 5, well, then they still got to go and get a PSG anyway and stuff. So I guess that could be looked at as a negative. But for all the reasons that people avoid going into a sleep lab, an HST just makes it that much easier for them to at least find out potentially, is it obstructive sleep apnea? And if it's not, well, at least you've eliminated that factor, and you can send them on to a PSG then and only then if that failed. So let's take a look at our approach, which is a little different than your first generation devices that were out there. Most of the devices that came, 10 years ago, they're simply respiratory channels. They're doing the best they can, and they're very nice devices, but they're doing everything with just respiratory channels and that. In other words, they have no idea when you're actually sleeping. They have a nasal cannula, they have some sort of effort belt, and they have a pulse ox. But the problem is that there's a high degree of wake within your test, which I'll get to later on in the slides here. The way that we do this is that we actually monitor EEG and monitor your sleep. And so that we're actually able to tell you whether you're awake or asleep and what stage of sleep you are in. Any other device that's not doing this is using some form of actigraphy, which is basically movement to determine whether you're asleep or not. And so it gives you a high risk of dilution within your test as you're using devices such as that. Now, as I mentioned previously, our device can also do multi-night studies, which lowers the risk of having to redo the test if something goes wrong. But also, there's variability between nights. And so if that first night, someone who is a very positional sleeper, happened to not sleep on their back, maybe they would look like they didn't have a problem. And then on the second or third night, maybe they did sleep on their back for a lot longer, and all of a sudden you see that their issue comes to light. So there's all kinds of reasons and positive reasons for doing multi-night studies. You also want to be able to have some sort of web portal so that you can share your data, whether it be with sleep physicians or other physicians that you're working with in the area. You don't want to have some sort of manual process. And then, especially when working with dentists, you want to make sure you have some sort of auto-scoring feature in that, so that when it comes to titration, you can actually run the reports yourself and see what's going on and see if those changes that are happening are positive, and if you're heading in the right direction. And we supply all of those items. So just real quick, let me review some of the channels that we have and some of the things that make us a little different. We are a typical chest-worn device, very similar to many devices that are out there. We do have a pulse ox. We do have a respiratory effort belt and a nasal cannula. But some of the things that really make us different is, for instance, our device absolutely gives you tri-axis positioning. It has an accelerometer in the middle of your chest, and it allows you to tell whether someone is sleeping on their left or their right, or they happen to be trying to cheat the test and they're sleeping propped up on a bunch of pillows. This happens a lot with your Department of Transportation, where the truck drivers just simply don't want to, be diagnosed and carrying around a CPAP and other things like that and stuff. So very useful information when it comes to that, and not everybody is able to give that. But as I mentioned to you earlier, the biggest thing is the EEG, which we'll get into in a little bit later. Lastly, I want to point out that the respiratory effort belt, not all belts are created the same. And if you go to a sleep lab, they use something called a RIP belt. And that is a belt that has a wire running through the entire belt, so that no matter how that person lays, you can still capture that chest expansion. And the reason that this is important is that it's one of the ways that you are able to tell the difference between obstructive sleep apnea and central sleep apnea. And for a dentist, that's very important, because one of them you can treat, the other one you cannot. So I would think that would make for very useful information if you're trying to do what's best for your patient. As I say, if you see here, this is what the final setup looks like. Not much different than probably many devices that you've seen throughout the years. And that, like I said, it's a chest-worn device. But that channel that's coming out of the top and it looks like it's disappearing behind his neck, that is our single channel 3-lead EEG. The blue box sitting in the middle of your chest, that is the brains of the device. And it does have an SD card in the middle there that allows for us to capture up to 3 nights on a single charge. Now, as far as ease of use, there's just one button. It makes it really, really simple. And there's not a whole lot of buttons for the patient to have to mess around with and things like that. You simply push the button to turn it on, and in the morning you push the and hold the button for 3 seconds to turn it off. Here's the great news: if a patient forgets to turn the device off, because everything is based upon sleep time and not recording time, like many other devices, none of that time that is still recording is going to count against the test anyway. Okay. And second of all, the device is smart enough that after it has been taken off, if the patient forgot to turn hit the button, it'll turn off on its own within an hour. So again, there's all these built-in advantages to make it that much easier for the patient to not only take the test, but for you and for any scoring and interpreting physician to go through the data. So let's talk a couple of things here that make the ZMachine a little different as far as from other devices that are out there. Number one, as I mentioned to you earlier, your typical type 3 HST, which for those that are not aware, a PSG, an in-lab, is a type 1. When you're dealing with HSTs, you have type 2, type 3, and type 4. Your type 4 device collects the least amount of information, and it's more of a screening device than a true diagnostic device. Most of your HSTs that are out there are your type 3 devices, which, like I said, they're very nice devices, but they're limited with only having their respiratory channels. A type 2 device has to have 7 or more channels, and it has to be able to monitor sleep. And so, as I said, the first thing that makes us different is the fact we are actually monitoring sleep. And this is a single channel 3-lead patient self-applied. So there's no extra burden on your staff for the patient to do this. Okay. But we are actually monitoring sleep. And as you see, let me see if I can move these pictures here. As you see in the right-hand side of the screen, we're collecting it from the mastoids, and then we have a ground on the back of the neck below the hairline that helps with any interference and static electricity. So why is EEG important? Accuracy. And towards the end of this slides, I'm going to go into some specific examples of AHI versus REI, and that plays directly into accuracy. So having EEG greatly improves the accuracy of your study. It also gives you that much more information. And we've all been, I know everyone on this call is a doctor, but we've all been patients. And when you're getting a test, let's use blood work as an example. They look at a variety of things when you draw blood. And so they're trying to get a complete picture of what's going on with that patient. They're not just doing cholesterol. They're also looking at, sugar, sodium, and all these other various items in that. Well, the same thing should be true when it comes to your sleep test. You want to have as clear a picture as possible and be as accurate as possible with what's going on so you can make the best clinical decisions for your patient. No one goes in asking for, a partial, just give me the minimum, I just want to know minimum what's going on with this patient and stuff like that. That's a good way to, not only harm potentially your patient, but to get yourself in hot water as well. Now, when it comes to reimbursement, of course, there's many dentists that are out there that are just simply using cash pay models, and that works perfectly well. And as I'm sure you're all aware of, these codes are medical codes. But if you're working with dental billers and that, or billers that can help you with medical codes and that, you'll be happy to know that using a type 2 device, because you're collecting more information, you're actually going to be paid more than you would be for a type 3. Now, of course, everyone may have, it's going to vary by state, vary by insurance. But if I could use Medicare as an example, because that's public knowledge, I can tell you that in almost every state, it's a good $50 to $70 difference of using my device or a type 2 device in general versus a type 3 device. So when Todd brought up earlier, as far as how can this help your practices grow, increased revenue is probably a good way, for doing the exact same thing. If you're going to decide to bill insurances, getting paid more for doing the same test, I'm sure is probably a nice way to think of that as far as growing and having a little extra cash to do things with. And as I mentioned earlier, Annette, there's no extra burden on your staff. We're not asking your staffs to put this on the patients. There's no need for that. Between training videos and the manual that we provide, this has been something very highly successful for several years. So a second thing that makes us different is we have a cloud-based platform. Now, when I say cloud-based, what I mean is that you will need to download the software to your computers, at least as of right now. One of the ways we're making this even easier is that in the next 2 months, we're introducing a browser or web-based version, which basically means that you won't have to download the software. As long as you have an internet connection, you just go to a website and you just sign in. So we're making this even easier than it is right now. But right now, it is simply a cloud-based platform where you download it to your computer, you sign in. And when people think of cloud-based, of course, you're going to think of security and storage. Obviously, we're HIPAA compliant. All of your data lives on our server. I'm not taking any extra storage space away from your computers. If your computers are stolen or hacked, I can't speak about the rest of your practice, but I can at least tell you about your sleep studies. They're all safe and secure on our server. Okay, it's backed up continuously. You don't have to worry about something being a static platform that you can't get back. But I think that's just as important. It would be the communication aspect of what a cloud-based platform allows you. So when you think about this from an invite standpoint, you can invite others, offices that you may be working with. You could share studies with General Sleep. And so there's no manual process involved. With the click of a button, you can share a study with someone else. Or for instance, you could share it with General Sleep and we could go ahead and score and interpret that study for you. Or if you have a local relationship with a sleep physician, you could share it with that physician and they could score and interpret it for you and get it back to you in a matter of 24 hours, 48 hours. So it just allows for easy communication and access to a large network of techs and sleep physicians to provide these services. Even Telemed services are available as well. So a couple of things that you can do with a cloud-based software, especially ours, is that you'd be able to upload this and archive it automatically. You would have access to the raw data. And so when you're going through, especially for titrations, that's where our AutoScore feature is right with the raw data. You can run your own fully customizable reports. We would help you do that if you wanted to. You can reorder disposables and any parts and accessories right through the portal. And you can view your full billing history and invoices and that. Everything's done automatically. So there's just a lot you can do with something that is that interactive. I mentioned Telemed. Some of you may be aware that there are 6 states out there that you can find all of this information on the AADSM website. But there are 6 states out there that the dental state board has determined that they don't want dentists handing out HSTs. Now, some of them, depending on what their position statement says, some of them are okay if you get a doctor's order. And so this is where a Telemed would come in very handy. whether you request it from General Sleep or you request it from another physician that you're working with. You can do all of that through the software with a click of a button, and just request that a doctor do a quick telemed with one of your patients, or like I said, General Sleep can do this as well. And we get you a doctor's order, and now you're under that safety umbrella, if you will, of having not just your name, but that other medical doctor that issued that order supervising or working with you on this. And so, and if it's not needed, if you're in a state where it's not needed, then great. No need for, it's just an added feature that you won't use. But in those other states, this could be something that could be very helpful for you. As I mentioned earlier, our device does have the ability to do multi-night studies. This is important, as I already mentioned, for the variability from night to night, or if you have people who are positional and things like that. So our device can capture up to almost 30 hours. So we say that you can do roughly 3 nights on a single charge. And then it only takes about an hour of charging time for each night of use. I did mention for your titrations that you could use the AutoScore feature. This is free. You just click a button, allow the software to do it for you, and then you can run a report right then and there and go over things, maybe even while the patient's in your office. Lastly, one of the features, again, it may or may not be used by you guys, is in recent years, we've made our device CPAP compatible. And so if you had someone who's maybe doing combination therapy, and you want to make sure that the settings were proper and things like that, you can test your patients while they're wearing their CPAP. This has been extremely helpful during the pandemic the last 2 years, where patients did not want to go into a sleep lab and do a full-blown titration of their CPAP. As far as getting that data off of the device, you, just like most devices, you just simply plug it into your computer. It's really, really simple. And it's just a USB connector, and then it automatically will upload. There's really not much to it. Now, the last thing, I've mentioned 2 things so far that make us different, the EEG and then the cloud-based platform. The last is something that I wanted to tie into something that Todd had asked me when we were discussing this whole thing, and that is cost. And so again, I previously mentioned something as far as, type 2s getting higher reimbursement. Well, another way that a ZMachine can be very, very helpful for dentists that are just looking to get into dental sleep medicine is that the cost of our device is much lower than most devices that are out there. You guys are free to do your own homework in that, but believe me, most of the HSTs that are out there are anywhere from $2,500 to $5,000. And they're going to share 2 things. They're not going to collect as much information, and they're going to cost you more money. And their disposables can run very high as well. In some cases, I've had some people who were able to get 2 ZMachines for the price of 1 competitive device. So one way that we can absolutely help a dental practice grow by adding their dental sleep medicine is the cost of our device. It's less than $2,000. It's only $19.99. And in addition to that, our disposables, it's only $11 for your single nights. If you wanted to do multi-nights, which many other devices are not able to do, it's only an extra couple of bucks. 2 nights would be like $13.50. 3 nights would be around $16. So again, cost, I guess what I would call bang for your buck. I would like to think we're adding quite a bit of value to the practice, both from a financial standpoint and a clinical standpoint. So a couple of things I want to end on here, and want to go back to accuracy and some important terminology here as you're thinking over much of this, and that is the difference of total sleep time versus total recording time. Okay, so for those of you that have not met me before, I've been in medical sales for about 25 years, and when I took this job 5 years ago, I thought I would mostly be working with sleep labs and on the medical side. And it turns out I do just as much, if not more, on the dental side than I do on the medical side. And in learning more about all of this, I've never seen a term more abused than AHI. And the reason I say that is that if you truly look at the definition, which I have up there right now, is apneas plus hypopneas divided by total sleep time. That is the definition. So if you're not measuring sleep time, you're not really getting an AHI number. You're getting what is called an REI. And that is your apneas plus hypopneas over recording time. And so, but there's so many different companies out there that just call it an AHI because that's what everybody knows. But it's really, that's not what it is. And so, these are important terminologies that people need to know and make the distinction between them. And the only way you're going to get that is you need to be actually recording and monitoring sleep. So what's the distinction between these two here? Total recording time, that is the entire time that the device is on. It's recording whether that person sat up and watched TV for a couple hours or was reading a book. All of that wait time is included in your test. If the same patient was using a device such as a ZMachine that was monitoring sleep, all of that wait time would not be, it would be recorded, of course, but it would not be included in your AHI score because I'm actually able to tell you when someone is awake or asleep and what stage of sleep they are in. So again, this is important, and I think this next slide will show you the vast difference there. So this, I always say this is especially helpful for dentists because you guys are always working with the patients that are on, well, for the most part, or many times, you're working with the patients that are on the lower end of the AHI scale on that have the moderate or the mild symptoms in that or interpretation. And so it's very important. You may run across an example of just like what I'm showing you right here. So let's take something that where in AHI, you've got 550 minutes of total recording time. Okay. And let's say that this was a non-ZMachine device. It was just, it was respiratory channels only, and all they can do is use total recording time. If you have 35 apneas and you divide that over 550 times, you're going to get an AHI of 3.8 an hour. Okay. That means that technically speaking, they don't have a problem. They're less than 5. Okay. But if you were using a device that was measuring total sleep time, and even though it recorded 550 minutes, they only slept for 400 minutes of that, that could be the difference of a 5.3, which now, technically speaking, insurance would cover getting that person an oral appliance or a CPAP and getting them diagnosed as having mild sleep apnea. So again, not a big difference there, but it could make the difference between, if you had a couple of these every single month, one is a diluted test, one is not. And so I want to make sure I point this out. When you're dealing with people on the lower ends like this, it's important to make sure that the numbers are correct. And
Nate, this is actually the piece of data that you and I discussed down at NADSM that kind of the light bulb went off for me. Like this has huge implications for revenue potential, because if you essentially, if you're misdiagnosing someone because you are recording or you're calculating total recording time, it's going to show an AHI of 3.8. It's like, don't worry, they're fine. Insurance isn't going to cover that. But in reality, if they're sleeping, let's say they're sleeping for less than 400 minutes, that AHI goes up to 6, 7. That's huge. That's huge. I mean, with just one patient, you could literally, and I'm not trying to advertise for you guys, because I am going to put you on the spot with a few questions, but with this device, if you have one patient that appropriately displays an AHI that falls within the boundaries of what insurance will cover for oral appliance therapy, you've paid for the ZMachine device.
Yeah, pretty much. Yes.
Because
Now imagine if you
your
had one a
average,
month.
yeah,
You
if your
know,
average collection is $2,900, and if you have accurate data that gets you just 1 to 2 more patients a month, you've paid for this device over and over and over again.
right.
So that's
So,
I just want to let everyone know, this is the piece of data that caught my attention in my discussions with Matt down in Clearwater.
yep. So no, and this and again, this is only possible if you if you're actually monitoring sleep. Again, I can't stress this enough, in the fact that if you're not using EEG, then which is, again, is the gold standard. It's the same thing they use in labs. Then you are using secondary signals, and you are what I refer to as, you're inferring sleep. Okay, you're not actually monitoring it. You're using a roundabout way to get there, and it's just not as accurate. And as Todd said, it's like, look, if you did one of these a year, okay, that would pay for your device, okay, in comparison to any other device. But imagine if you had one of these every month, or God forbid, multiple ones every month, depending on how many of these you do. You can start to see how this adds up and builds value to your practice, both from a financial, obviously, but I would also like to think that we're all in the game of helping people, and so both from a clinical standpoint as well. So
yeah, and we do have some questions starting to come in, guys. We will get to your questions at the end of Nate's slides here. I do have one more question that I wanted to ask before you finish up here. How does the data that your guys' test provides, how does that help in the relationships between dentist and primary care's dentists and specialists, whether it's ENT, pulmonologist, cardiologist? How does your guys' device help that relationship?
So, going back to what we had talked about earlier, as far as having more data, having more accurate data. If you are forming relationships with local sleep physicians, I have seen it myself. It does nothing but impress them that that you're using something that is a type 2 device. It's gathering more data. Nothing can put a relationship more on the rocks with, let's face it, sleep physicians that in most cases aren't willing to work with dentists, or don't want to work with dentists, or don't feel that they have the experience and things like that, than to find them using something that is inferior. Okay.
Or perceived to be inferior by the
perceived, yes,
yeah,
perceived, exactly. So the fact that again, as you're building up your practice and you're doing more and more of these, and imagine like a resume or a portfolio. You're putting this together, and you're trying to attract a sleep physician to work with. And they find out, okay, I've done this many studies, and then they start looking at it and say, okay, well, I'm, and forget, it doesn't even have to be a ZMachine. The point is, you're using, let's say, a type 2 device. You're using something that's collecting a lot of data. It's well known in that, and you're not using a type 3, a type 4, something like that. I've seen it myself. It usually does nothing but impress them, as far as that you made that decision to collect that much data, and to try and have as accurate of test that you possibly could bring to your practice. So
yeah, and I think what that does is it gives the sleep physician more confidence when referring to you, the dentist. I think that's the revenue generating opportunity there, is when you start, let's say, they come back with an AHI of 50, and obviously at severe risk, they need a CPAP or some other combination therapy, whatever it might be. You send them to a pulmonologist or an ENT, along with the sleep tests, the multi-night sleep tests that you've administered, and they're like, oh, this actually collects plenty of data. This looks very similar to the data we collect. Yeah. And what we've noticed, and what a lot of the dentists who are on this call can probably attest to, is that sleep physicians already think dentists are driving outside their lane. So anything you can do to make that make building that relationship easier is only going to benefit you in the long run as far as growing a sleep practice goes.
Yep. Well, and Todd, I'd also say this as well, in the fact that just think of it from a clinical standpoint, in the fact that what if you had you had this great working relationship with a local sleep physician, and they maybe they're using an HST, maybe they're they have it, they're in many cases using a PSG, and so now due to this relationship, they decided that the ones that are appropriate, they're going to share with you for oral appliances or laser treatment, aligners, whatever your treatment possibilities are, and now you're using a device that's a type 2, and they know, and again, maybe that's one of the reasons they chose you, but the point is that when you look at their data and then you've run your own test to see how things are going, they're going to line up better. Okay, you're not going to have these discrepancies and stuff because they use something that is the gold standard, and you used something that was less or potentially could be viewed as inferior. Mm-hmm. It's going to potentially frustrate you and wonder, well, wait a minute, I created this appliance, why are they not getting any better? And you're wondering various things, and that's because you're not starting from the same starting point. Whereas at least when you have a type 2 device and you're collecting more data and things like that, I'm not here to tell you we're a PSG, as I illustrated at the beginning. They're two different things, but at least I'm getting, we're trying to get closer to that as best we can with the information we've gotten at. So there is these intangibles that I think would play into this when working with physicians in your local area. So yeah. And I'm almost done, everyone. Believe me, I've only got a slide or two left here. I wanted to really kind of drill this point home here. You guys are all probably familiar with a term RDI, and in many cases, if you're already doing sleep, that the difference basically between an AHI and RDI, it's apneas plus hypopneas plus RERAs, okay, over sleep time. Now, this is important because I'll show you an example on the next screen here, because if the AHI is kind of on the border, but the RDI is over 5, there are some insurances that will allow you to treat that patient, pay for them, and so it's good to have those numbers. Well, again, the RDI, when you're looking at this, you're only able to have RERAs, if there are arousals. So you have to be monitoring sleep with this. And so, purely if you look at the definition, it's the same thing: apneas plus hypopneas plus RERAs over sleep time. If you're not monitoring sleep, you're not going to be able to do this and stuff. So again, I want to point this out. And if you look at this next example, this is an actual example of a RERA here. But the point is that you can see there's no significant oxygen desaturation. Maybe they went down a point or two. They were heading towards that route, but you can see there was an arousal. In this case, they went from deep sleep to awake, but it's really, I believe the definition is going from one stage to another. Your body, in layman's terms, the way that I was always taught was you were on your way to a hypopnea, and all of a sudden you had an arousal. Your body, woke up, changed sleep stages, basically said, I need to take a breath. And so you never quite made it down to the definition of what a hypopnea would need to be, whether it was 3% or 4%. You were on your way there, but you didn't make it before your body did that. Well, that's still an event, because today's RERAs could be tomorrow's apneas or hypopneas. This is a progressive disease. And so you have to keep that in mind, that that's why they even have this indication here. So, but again, none of that's able to be seen if you're not monitoring sleep. So let's take an example here to end everything. So this is a possible real situation where maybe you have someone who has an AHI that's on the border. Okay, it's 5.3. Maybe you'd have one that's, you could ask the same question. It was 4.9. But then you look at the RDI, and in other words, this person was having a lot of RERAs. okay, their RDI is a 16, more than well into the range as far as being able to do this and stuff. That's probably someone you'd be able to treat. Okay, insurance would allow you to do that, and it would make sense. But let's say that you have someone that similar scenario, Nat, but their RDI is very where you're not able. A better example is probably that, hey, you're not able to tell what the RDI is because you're not able to monitor ResMed. So the best you've got is this 5.3 or 4.9 or something like that. Again, going back to Todd's statement earlier, if you're not able to do this, then again, that's a patient that technically speaking, maybe you shouldn't be treating. Okay, or at least as the numbers are showing, they may not have a problem and stuff. Maybe you do a snore guard, things like that and stuff, but you're not going to be able to see the complete picture because again, you're lacking certain things and stuff. So that RDI can be rather important, and hopefully that kind of makes that point there a little bit. Lastly, my last slide here, again, we've covered this before, so I just want to make sure that I'll get to some questions and stuff, but just recapping some of the stuff that that we had talked about earlier here. And if anyone has any additional questions that don't get answered this evening, Todd wanted me to make sure that I put my phone number and my email up on the screen there. So if anybody has any additional questions for later, please feel free to reach out to me. I'd be happy to go through and show this to you or talk to you a little bit more in regards to this. But Todd, if you want me to answer some questions, I'd be happy to try and do that.
Yeah, let's get to people's questions. I have one question before we get into that. There's a lot of programs out there where they will mail sleep tests directly to your patient's door, sleeptest.com.
Yep.
I mean, those make things operationally, workflow wise, a little more simple.
Yes.
Do you guys have anything like that?
So as of right now, we do not. We are not a sleep lab, an accredited sleep lab, which is many of the people that you find that do that. And we're not a service company either. We're simply a manufacturer. Okay. I will tell you that we have thought of and we may look at introducing something like that later this year. But the short answer to your question is no, we do not provide that. But I can tell you, for those of you that are using a service and you want to look at incorporating something like a ZMachine, there are lots of pros as going with a service in that. One of the cons is that you don't know what type of device they're sending out. They make things really easy for you, but that you don't know what testing device they're using. And if they do, in many cases, they may be using some of the stuff we've just talked about here recently. I work with a lot of sleep service companies. And so if owning a device is not for you, at least for now, until we introduce it ourselves, I have plenty of companies that I can turn you on to that they will be sending out a ZMachine when you request a study from them. So you can be assured that you'll get all this data we talked about without having to own one. Does that answer your question, Todd? Yeah,
that's great. And like Nate was saying, if you guys want to email him and ask how to get in touch with companies who do send out a ZMachine unit right to your patient's door, just be sure and email him or call the number and extension on the screen, and Nate can get you that information. So let's go ahead and let's get into people's question. Question number one is, how much are the units and do you lease them?
So yeah, hopefully everyone saw those slides just a little bit ago. So the device is only $19.99. And we do.
That's $1,999.
Yes. Yes. Sorry. Yes. So yes, just under $2,000. And yes, we do have we can spread your payments out. It's a lease to own. So we don't have a true rental program where you can return them. But if you wanted to spread your payments out over the course of 12 months or 24 months, we can absolutely do that for you.
Okay. Next question is, how much are the disposables, the belt specifically?
So the belt is reusable. So when I say disposables, so let me answer that two ways. Our belt is a reusable belt that will last you years. If you did ever need to replace the belt, it started to to look worn or not work and things like that. It is a charge of $199 that you can replace that. It is a custom built belt. Now, to answer your question as far as the actual true disposables, let me answer it this way. What is included in the disposables is your nasal cannula, your EEG sensors, your medical tape to tape down your nasal cannula, your finger probe, and anything else that you want to use it for, and plenty of alcohol wipes to prep the area and clean the area in the morning where your EEG is now. Plus, in addition to all of that, any cost that's associated with the software, the storage of your data, customization, updates, all of that, it's already baked into the price of the disposables. We do not have a setup fee, training fee, storage fee like some other people doing that. We do ask that you get your disposables through us. So the answer to your question is single nights will run you $11. A 2-night study will be around $13.50, and a 3-night study will be about $16. We sell everything in packs of 10. So we don't make you buy in bulk by any means. So if you wanted to be a single night person, $11 times a 10 pack, it's $110 every time you buy disposables.
Okay, perfect. Next question is from Ravi. He says, putting insurance aside, is it required that the patient see the doctor and the doctor gives a recommendation for the sleep study before doing one? And could we have our patients do a ZMachine sleep study before their first appointment, perhaps after a screening questionnaire?
Yeah, so that's yeah. And again, I'm not a billing expert, so take this with a little bit of grain of salt. I probably for that question, that might be one that if you want to contact me at a later date, I can have one of my techs on, who's a registered polysomnograph tech, who's worked on the clinical side for years and is actually now our corporate trainer. She also has some billing experience, but I think what she would say if she was here is that if you're in one of those states that again does not have any issues with dentist handing it out, and again you said insurance aside, then yes, you're not under their regulations, if you will, to do this and stuff. So there shouldn't be any issues as far as you handing it out yourself, and with or without doing the telemed. Of course, if you wanted to be conservative and make sure that you were covered per se, you could always have a doctor's order and request a telemed. There's nothing wrong with that. It's just a little extra money to it's like a security blanket, if you will. But without insurance, yeah, I believe the answer is different than when you're dealing with insurance, because let's face it, I mean, getting reimbursed versus you doing a cash pay, now it's more of just coming down to liability and things like that versus being paid by insurance.
Okay. Yeah. And Ravi said, I don't care about billing.
They still will want to make sure that you did a legitimate test when you go to create an oral appliance or decide you're going to do laser treatments and things like that and stuff. They still want to make sure that it's legit. So there is that to consider, even if you're not billing for that particular test and that. But whoever had asked that question, feel free to email me, and like I said, if nothing else, I can at least have our tech give you a better answer, or than I can provide in that, just because of her experience.
Okay. Joe Van Ralt asks, how does your device compare to specifically WatchPat 1 and WatchPat 300 and the newer sleep image device? And she said all are billable at $95,800 data wise and cost wise. She's wondering how you guys compare to the WatchPat 1 and WatchPat 300.
So the 300 is the reusable, if I'm not mistaken, and so please, anybody correct me if I'm wrong here, but I believe that the 300 is the reusable, and if I'm not mistaken, that goes for around $4,500 to $5,000. Disposables, you have to swap out a finger probe every time you do that, and I want to say that's like $65 to $85 every time you do it. And so very nice device, very easy to use. That's their pitch is their ease of use and stuff, but it's rather expensive, and you're not getting any additional benefit out of it. As far as you said, they went ahead and paid the money and did everything to be able to build the same code that I do in that, and jump up versus your typical Type 3. So yes, you are correct on that, but it's expensive disposables, expensive device, and you have to decide is that worth it as far as doing that cost versus ease of use. The other thing you'd have to consider as well, again, just throwing this out there, is that we're just not in that age where I think you can collect all the data that you need from your fingertip. We're just not there just yet and stuff. If that was the case, every sleep lab in the US would be doing it that way, and we're just not. And so a very nice device, but I just it's still limited as far as what it can do in that. The only difference between that and the 100 or the WatchPat 1, I believe, with the disposable, I'm not sure of the exact cost. I want to say it's around $100 or something like that. So that is $100 every single time you use it. So that reoccurring expense never goes away. And so when being in manufacturing as long as I have yet to meet a disposable device that is better in the long run than a reusable device when it comes to financials, because eventually when my device is paid off, you only have $11 that you're expending every single time. When you have a disposable, whether I'm wrong and it's $85 or $100, whatever that costs, it's roughly around that. You're spending that every time you use it and buy it, okay, and hand it out. Yeah, you're throwing it away. You don't have to inventory it, clean it. I get all of that again, but you have to think from an expense standpoint. You're spending that every single time. It's kind of like the difference. I guess my best example is making a pot of coffee versus a Keurig cup. Okay. Those Keurigs, boy, they're really nice to have and stuff. But, when you think of what we've done to the planet as far as throwing those things away and how much they cost and stuff like that versus making a pot of coffee, it adds up quickly and stuff like that. So did I answer that question thoroughly for that person?
I think so. Joan, if you want some more information, just type in the chat. Let me know if that answered your question or if you need some more clarity on that. But Dr. George Bear says, send me the names of those companies. George, email Nate. His email address is on the screen, and he'll get that info to you. Karen Johnson, she said, what other advantages of Z compared to ResMed or WatchPat other than just Type 2 versus Type 3? Are there any other advantages?
Well, so with the
I think you've displayed that cost
yeah.
over the lifetime of the unit is less. I think that could possibly be an additional benefit.
Yep.
Yeah.
Well, but I would say there's clinical value as well in the fact that, so let's start with your ResMed. Your ResMed is, depending on which one you either have a 4 or 5 channel device. So right away, you're collecting less data, okay? In many cases, you don't have position. We've already discussed that. And again, hopefully all of you realize I'm just answering your question. I am not in the habit of trying to tear down other devices. I'm just trying to literally answer the questions as you've asked them of me and that. So, and you can look all of this stuff up yourself. But when you're talking specifically in regards to ResMed, they use something called an air cell belt. And if you've ever seen one of those belts, everything is connected to this single area where it pushes and pulls and that. And if you lay on that in the wrong way, you are not capturing chest expansion, and therefore you have no idea whether this person has centrals or obstructives. And again, this is important because you won't one of them you can treat, one of them you can't. So there's a reason why your sleep labs and why we've chosen to go higher on what I'd say the quality level, and to use a RIT belt, because no matter how you stretch that thing, and the wire is going to allow for stretch, and you're going to capture chest expansion for obstructive, or if there's no chest expansion, then again, ResMed, you don't even have to ask. You can ask anyone. They know that one of the things that they have as far as, I guess you'd say, a flaw is that they're not great at picking up centrals, and so that's not coming from me. You can ask anyone in regards to that, and it's because of the type of belt they have. So number of channels, type of belt, lack of position. As I've said previously, and that lack of monitoring sleep, they're doing the best they can with respiratory channels, and that's it.
Okay. All right. I think, and she said, yeah, some answered already. Thanks.
Yep.
Dr. George Baer said again, I was told WatchPat was sold in a box of 12 and each would cost around $120 each. Maybe I'm wrong, but I don't think so. That very well might be.
So it's even higher than what I said. So we'll go with your answer then. So if that's the case, so I was trying to be conservative, but yeah, and again, I want to point out because you guys deal with this more than I do, but that is an example of what I would say buying in bulk. Okay, they're saying, okay, well, you got to buy them. They're $120, and I got to buy 10 or 12 at a time. I mean, what if you're a practice that only uses it once a month, twice a month? Okay, something like that, especially when you're getting started in that. That's a nice, that's a chunk of cash to be outlaid for that and stuff. So these are all things you have to think of when you're doing this stuff. But yeah, your number's higher than mine. I'll take it. We'll go with yours. So.
And then George said, thank you. I'll be calling you later. I like what I see and hear. All right. So expect to hear from Dr. George Baer. And I think that is all of our questions. That's everything. So Nate, thank you so much. We're right at about an hour. So good timing. I appreciate your time sharing your guys' product and how that can help our clients or the people that follow Dental Sleep Profits, how that can help them accelerate and grow their dental sleep practice. Again, if you guys want to reach out to Nate, his email address is there on the screen, craft@generalsleep.com, as well as his phone number. Just go ahead, if you're on your laptop, hit the control, what is that? Function print screen. And and then paste that into a document, and you can have his information, or just take a picture of your screen. So Nate, do you have any last words? That sounds weird.
No, I want to thank you, Todd, for having us, and everyone that's on. I hope that you found this informational. Even if you don't use a ZMachine, or you're perfectly happy with what you have now, as I said, I've been doing this for a long time, and it's always good just to share information, and now something maybe you didn't know the other day. And so even if we don't talk now, I hope you think of us in the future, and we're all on the same page, just trying to help patients and to tackle this problem. And I'd like to see more and more dentists do this, because again, you guys are right in that area. You're examining the mouth, and I'd like to see this to grow as much as possible. And the only way you do that is through things like this, where you educate and talk with people and stuff. So I appreciate everyone spending time with me this evening, and Todd, for having us. And I hope this has been well worth everyone's time.
Yeah. And last thing, are you going to be in Dallas next week?
Yes, I am. So
all right,
I will be there. So I forget, did you say you're going to be there?
Yeah, we're a gold sponsor of AADSM, so we'll be there.
Okay, perfect. Yeah, I will be there. And so yeah, we'll see you guys. Make sure I'll stop by the booth, or you stop over in that. But yeah, we'll look forward to, I think this is the third time I've been in Dallas this year. Right? It's crazy. Oh, wow. Everything's in Dallas this year for some reason. So
everything's in Texas and Florida for some reason.
When I heard it's already muggy, so be prepared to bring your shorts. I was dealing with a customer earlier today, and I told him I got to be down there, and he's just like, "Oh, Nate, it's already like 80 degrees, and it's just super muggy." And I'm like, "Oh, great." I'm dealing with 30 degrees here in Ohio, and I still got jackets on and stuff. So.
Well, thankfully the meeting is indoors in an air-conditioned building. We'll be good.
Yes, exactly.
Right.
So,
well, take care.
Well, thank you, everyone.
We'll see you next week down in Dallas, and everybody else. Thank you so much for joining us. Have a great night.
All right. Good night, everyone.
Night.